Hi everyone, thank you for this opportunity to present on my research looking at lung function in transgender people. Firstly, I'd just like to acknowledge that I've received support from the Telethon Kids Institute, ANZARIS and the IPH Research Foundation. So in general, there is a lack of research in transgender health. We don't know how many transgender, intersex or gender diverse people there are in Australia because the ABS census has never accounted for this population. What we do know is that there has been a rapid increase in the number of transgender people seeking healthcare. However, transgender people face numerous barriers in accessing healthcare and will often avoid healthcare due to providers lacking in transgender health education, discrimination and refusal of care. So there is currently no published data on comprehensive lung function in healthy transgender, intersex or gender diverse people. There is also no published data on the effects of gender affirming therapy, including hormone therapy or top surgery, on a person's lung function. When we measure a person's lung function, we compare the lung function numbers to a reference value, which is determined by a person's sex, age, height, and ethnicity. How the lung function numbers compare to this reference value is used to diagnose and manage lung disease, classify how severe it is, and is also used for some medication or research trial eligibilities. The current reference values were designed for a cisgender population, relying on the selection of sex as a binary field, either male or female. Current guidelines state that when selecting a reference value, that we should choose the patient's sex assigned at birth, as this is what determines lung size. However, there is a lack of evidence supporting this guideline, and it assumes that gender affirming therapy has no effect on lung function, which has never been investigated. So when we have a patient who is trans, intersex or gender diverse, there's a lot of uncertainty about which reference value to select. So this pilot study aims to investigate the suitability of using assigned sex at birth to generate lung function predicted values in people who are trans, intersex and gender diverse. And we also aim to develop consumer-led recommendations for reporting demographics for these individuals through semi-structured interviews. We're also doing a sub-study which aims to determine the effects of gender affirming therapy, including top surgery and hormone therapy, on a person's lung function. So for the primary project, we aim to recruit 100 people who will be asked to complete 2 questionnaires detailing gender affirming therapy and respiratory health, comprehensive lung function testing, and an optional interview. For the interview, participants will be asked to provide feedback on what language they prefer, how they would like their reports to be displayed, and also they'll be asked for their thoughts on how we can navigate the presenting issue. So for this sub-study, participants who plan on initiating gender affirming therapy, either top surgery or hormone therapy, within 6 months will be asked to repeat the lung function testing and questionnaires at 6 months and 12 months post-initiation of that therapy. So mean Z-scores and standard deviations for all lung function parameters will be calculated according to the current male and female predicted sets. And overall good fit is suggested by mean Z-scores of 0 with a difference of plus or minus 0.5, a standard deviation of 1, and approximately 90% of results falling within plus or minus 1.64 Z-scores from the centre of normal curve. And if neither male or female predicted values are a good fit, it suggests that the current predicted sets are likely inadequate for this population. And this will provide rationale to expand the study protocol to reach sufficient power in line with current international guidelines for the generation of predicted sets. And for this sub-study, lung function data will be compared between each visit for each participant, and clinically a change greater or equal to 10% between annual visits is considered significant. Linear regression modelling will be used to compare lung function changes over time relative to age-matched cisgender controls. So where are we at? So we've obtained $30,000 of grant funding, and we have site authorization and ethics approval, and we've recently commenced participant testing, and we've completed 8 primary project visits. And I'm hoping that the results of this study will contribute to providing a more inclusive and equitable healthcare system for all. Thank you.